Dylan, of course, went through extensive medical evaluation process, and he decided to go ahead for the epidural spinal cord stimulation treatment, and this is what he received almost a month ago.
Mm-hmm. Yes, that is correct, doctor. Thank you for sharing more information about medical perspective. Doctor, I would like to ask as well, what treatment did Dylan received? And from I remember from the consultation initially, we have different plans, and due to reasons, I think the family as well decided to do something else, which they
Hmm.
have collaborated with us about their challenges. And I believe Dylan pursued lumbar stimulation and stem cells. And why did we suggest lumbar instead of something else?
Right. So of course, the main concern in Dylan's case was the loss of lower body motor function. He had regained a certain amount of upper body functions due to spontaneous recovery after the trauma, but also extensive physical therapy, rehab, and nerve transplant surgeries. So the main concern stayed uh, lumbar, the loss of motor function in the lower limbs. So hence the main treatment recommendation was to target the lumbar spinal cord, which is basically a part of, actually it's the lower part of the spinal cord at lumbar level, which contains our uh, motor neurons for the lower body motor function. So when we looked at Dylan's MRI scan, we could see the spinal cord was not completely severed. Of course, it was
Mm,
damaged, but it was still connected, and there were partial signals passing through the injury, going to the lower uh, level, trying to produce some kind of stimulation of the lumbar spinal cord to trying to produce some movements. Of course, the level of stimulation naturally coming from the brain was not sufficient for Dylan to move the muscles in the lower limbs. And hence, this is what we basically targeted. We performed a small surgery to implant a plate of electrodes into the lumbar spinal cord to provide extra stimulation. As a result of the extra stimulation, that part of the spinal cord became super excited, and it started to produce muscle contractions. And I think Dylan can maybe testify. Initially, it was like random movements. With more and more
mm,
training, it's becoming a little bit more controllable movements. And this is, of course, the idea behind the treatment, that after the long-term stimulation, long-term rehabilitation, we are expecting the motor control to become better and better over time, and to an extent where we hope Dylan will have enough strength, enough control in his body to be able to walk with the upper limb support. And that's why also I think his upper body function will be very handy, because and I think he still have, in my opinion, he has enough strength in his upper body to remain focused on his lower body to improve his locomotor functions in the future.
mm-hmm,
Mhm.
mm-hmm. Yeah,
So maybe Dylan can also share his experience so far. So it's almost 1 month, and I think Dylan is coming towards the end of his initial
yes.
treatment stay, which is, I believe, is end of this week. So Dylan,
Mm-hmm.
can you tell us a little bit more about your, I think let's start with the surgery itself, because of course,
Yes.
many patients, they would like to know, we try to explain them, but it's really difficult
Mm,
sometimes, right? So patients would like to
mm,
know, what does it feel like to go through this kind of procedure, pure
mm-hmm.
from pure surgical point of view? How did you
Yes.
prepare? What did you go through?
Mm-hmm. Yes, I believe patients are quite anxious, or they
Mhm.
think that it's a surgery, it's a big one. Or could you tell us, Dylan, was it painful? How did you prepare? Stuff like that.
The surgery wasn't painful at all, just pretty straightforward. And go in, get the surgery done, go out, and then start off from there.
Mhm. Did you feel like pain? Did you feel
Mm-hmm.
uncomfortable during or after the surgery? Mhm.
No, the only thing that surprised me was when they actually turned on the stimulator straight after the surgery. So that was like a
Mm,
bit of a surprise. But after I got used to it, it became more controllable and more
Sure.
easier.
Right.
mm-hmm.
So initially, of course, the patients, once they're not when of course they're not used to the stimulation, right? So it's like sometimes quite sporadic movements, sporadic sensations, but over time it becomes more precise, more fine-tuned, and becomes smoother, of course, to produce and control those movements. And also, I think again, many patients, they would like to know, what does it feel like to go through daily activities? What does it look like in terms of the quantity, the quality of the therapies? What do patients actually do in those 4 or 5 hours they spend every day during training? So Dylan, can you tell us a little bit more about your basically a typical day in your life in the hospital?
So in the hospital, I do my morning routine, which is bowel care, obviously, and around 9 o'clock, I go downstairs to do the physical therapy, and they walk me through it. They tell me what to do. Like now I can, when they turn on the stimulation, I can lift my legs up, lift my ankles up and down, and PT, like after physical therapy, PT, they just do my upper body. And then in the afternoon, I go back to the physical therapy, and they give me an e-pacer, which helps me stand up and walk, which I was not able to do before the accident, before the treatment.
Excellent. Yes, so I think speaking of your, of course, functional recovery, so there had been a certain level of, I would say, of course, it's very initial state since we are just trying to complete the mapping. I believe your extensive locomotor training program will start afterwards. But so far, I believe you had seen some signs of initial recovery. So could you please tell us a little bit more in terms of your functions? What are some of the things you were not able to do before, which you can actually do now?
I've noticed that I have a bit more sensation in my legs. I can kind of tell when my legs move on its own from the spasms. That's all I can really think of.
So that's interesting, because normally, as we know, the improvements in motor function come from the stimulator. The sensation is normally not the area which is being targeted from the stimulation directly. Those changes normally come from the stem cell treatment, which also I think is the improvements in your sensation might be attributed to your stem cell treatment. And in terms of your motor function, you had a little bit of mobility back. I know, of course, not an extent where it becomes functional again. But I think there are initial recovery in your motor function. So could you please tell us a little bit more in terms of which muscles you are able to move, volitionally, and to which extent? When the stimulator, of course, is turned on.
So when the stimulators turn on, basically I can move my feet, my legs up and down. It's easier for me to lean forward and backwards. Yeah.
Okay. Excellent. And so I think we may have some questions from Mr. Antonio and Miss Maria. They would like to ask something from to Dylan. So
yeah,
I don't know if they had asked those.
I think they might have some question. Let me check for you, doctor.
Okay, thank you.
To those who are watching, please feel free to ask. All right. I see some people are raising their hands. Please, you can put in the chat section your questions so we can ask Dr. Nasir or the patient. Hello, Dr. Nasir.
Yeah, I'm here. Yeah.
Also, to those, I think we are also live on Facebook. If you do have questions, feel free to ask in the comment sections. All right, Dr. Nasir, since we're talking about, how the typical day looks like, it's 35 days. And as you know, as we know, it's not just the surgery that we do. We do something else. For example, the therapies, the stem cells. Can you tell us a bit more about why these treatments is included in the initial treatment and why it is important?
So basically, there are two components of the whole treatment plan. One is which is the main one, is the spinal cord stimulation, which involves a small surgery to implant a neurostimulator in the spine and to basically provide precise stimulations to different segments of the spinal cord to move different muscle groups. Once there is certain level of stimulation to the muscles, then we basically fine tune those settings through a process which is called mapping or programming. So mapping is done around 4 hours every day, around 100 hours during the typical treatment stay. And during the mapping, we basically find different combinations of settings which are producing different movements, like more precise, more fine-tuned movements. So then we combine all those settings together basically to provide a single level of stimulation to all of the muscle groups required for walking. That's the final ultimate program. Once patients had those final programs, they are advised to perform locomotor training. So of course, it's a long-term recovery process. So this is one treatment part. The second one is, which is a smaller one, is a stem cell treatment. So as we understand, the epidural stimulation is excellent when it comes to motor function, the autonomic function. But when it comes to sensations, it doesn't really do much on its own, at least not directly. For this reason, we also combine the treatment with stem cell treatment. So stem cell treatment may promote the growth of some spinal fibers at the level of injury. They may help the stimulator to function better. And I think this is also partly maybe attributed to recovery of sensory function in Dylan's case and in many other patients. After the stem cell treatment, they reported improvements coming back. Of course, they may need another treatment in the future, but even I think we can see partial recovery of sensations after a single stem cell treatment. That is excellent. So this is really the whole program with two components, the stimulation and the stem cell treatment, to target two different components, two aspects of the injury.
All right, Dylan, speaking of the surgery and, doing all this, I believe it's kind of like a hard work. Can you tell us how long did it take for you to see improvements? For example, motor or if any sensory, what kind of improvements did you experience?
Um,
How soon
uh,
did you have it?
how soon? Probably when I started doing the physical therapy, when I started and after the surgery and after the stem cells, that's when I started to see more improvement.
All right. Speaking of the treatments, did you experience any side effects or, some?
I think after the first dose of the stem cell, I just had a little bit of a headache and nothing too major.
What about the surgery? After the surgery, anything?
No, not really.
Because in many consultations, I think, doctor, it's one of the main questions, especially for example, of the parent or maybe the partner, So I think it's important to see that the side effects or complications exist. They are not zero, but it can happen. But with Dylan, it seems like everything went smoothly except for something in the stem cells. Doctor, speaking of possible, side effects or complications, maybe you can tell us a bit more about it.
Sure. There are some, of course, possible risks involved, which are associated with the surgery itself. Is actually not specific to the implanted device. It's more like the surgery itself, where there is a small risk of post-operative, intraoperative, post-surgical infection. The incident rate in our experience is very, very low. Is I think close to 2%, less than 2% actually, but it is not zero. And we take all the precautions necessary, all the protocols all the guidelines to minimize the risk of infection. So this is one. And then there are some minor changes in the blood pressure levels because the stimulation may make some changes in the sympathetic pathways, the part of the nervous system responsible for blood pressure regulation. So the stimulation to those specific areas may be may produce some temporary or mild changes in some patients with spinal cord injury, particularly when the injury is at a higher level, maybe upper thoracic or cervical level. From the stem cell treatment, I think also Dylan mentioned small risk of headache, fever, back pain, sometimes nerve pain in the legs. So these are some of the known, or I would say worth mentioning, side effects or complications we had noticed in our previous patients. We have a question, sorry, from Miss Maria, who would like to ask Dylan, when was your accident?
January 26th. Pretty sure it was 2022. Yeah, so,
Right.
Doctor, in line with the time of accident, how do you think it is important to, to do treatments or any other therapies or any other treatments when in terms of the recovery?
Yeah, I think this is one of the important factors, especially within first 2 years after the injury, and because we call it a golden period for some potential recovery. Basically, in first 2 years, there are important changes, pathophysiological changes in the spinal cord, where our body is trying to replace the diseased or injured tissue with like scar tissue, which itself is, of course, a natural defensive mechanism from our body, but it is also very basically devastating for any potential future recovery. Because once the area is completely sealed off with a thick scar tissue, it becomes extremely difficult to regenerate or regrow any further tissue. So normally this process takes place within first 2 years after this kind of trauma. So I think that's the period where, of course, if possible, patients should receive the treatment and to maximize the chances of recovery. This is also important for stem cell treatment because this is a process where stem cell treatment may play a bigger role, where stem cells may be able to reduce the inflammation, able to basically keep the window period for recovery open a little bit longer period of time. But having said that, we also had patients who were very, very, many years after the injury, basically, sometimes 25, sometimes even 30 years. I think we had patients who were 30 years post-injury. In those patients, I think the recovery is, of course, if the injury is many, many years old, the recovery may take longer periods of time, at least for the motor function recovery. But again, sooner the better. I think this will be my general answer.
All right. Well, in case of Dylan, I remember they are very, proactive and would like to start a treatment soon, which is very good. And it seems like, it's giving you more a boost to take a chances for the recovery. But, for older injuries, definitely the potential is still there. So, for patients who have older injuries, I think it's still good decision maybe to try and check and see the opportunities with epidural stimulation. Dylan, I remember in the first few weeks, we have worked closely with the nurses when in terms of your bowel functions. There is a question asking, did you see any improvements or what kind of improvements are you seeing with bowel and bladder functions, if any, at this point?
I haven't really seen any improvement yet. Yeah.
Doctor, in terms of bowel and bladder function, do we see it soon later, or how is this more like a more challenging area to treat?
The volitional motor function is one of the areas which comes first for obvious reasons, because this is the main target. This is what is directly targeted by the stimulation. For bowel and bladder function, normally it comes gradually over a period of time. So what we have to do, we have have to actually continue to use the stimulation, which provides long-term consistent stimulation to the sacral spinal cord, which is slightly below the lumbar spinal cord. So it doesn't receive direct stimulation, but indirect stimulation over longer periods of time. So this can regulate the autonomic activities at the sacral level, which can improve bladder and bowel functions in those patients. So I think this is, of course, one of the goals for after a long-term use of the stimulation and from the stem cell treatment also, because stem cell treatment can also play a small role in recovering those areas. And Dylan, I think, sorry. So since your stay is coming to an end, and I'm sure you had made some plans, which of course it was emphasized before that after the treatment, you would need to get into a good rehab program back in Australia. So can you tell us a little bit more what your plans are? What do you plan to do basically starting from essentially next week?
Probably I'll take next week off, like compared for physio, just get back into Australia time, and maybe next fortnight I'll probably start going back to physio, which 4 days a week I usually go for 1 hour, but I'll most likely be at home just when I'm with my mates or with dad or my uncle. I will do like just what I usually do with the physical therapist.
Okay. And Dr. I think we have. Sorry. Yes, we are.
Yes, Dr. Nasir. In line with the previous questions, I think Rachel, one on Facebook asked, "Hi, does this have good effect on bladder function?" I believe maybe they're asking for epidural stimulation.
For the bladder function, I think there are 3 components of the bladder function. One is the sensory functions. The other one is the autonomic, and the third one is somatic muscle function. So these 3 components of the nervous system need to basically come together to produce a significant recovery. So we had seen some partial recovery in the bladder function, bladder sensation, and also partial recovery in patient's ability to control the bladder and push the urine out. But I think a full recovery is not something which we really expect in the bladder function. A partial recovery is possible, but that too also comes, as I explained, after some time. It doesn't happen really immediately. Again, the main focus from the stimulation, the main expectations are the recovery of on-ground locomotion.
Dylan, there are also some questions about, because we mentioned earlier about how your typical day looks like, and how many hours of trainings or mappings do you spend during the day or the week?
So the mapping sessions, there's 2 mapping sessions during the day, 2 hours each, and the PT sessions go for 1 hour a day and 6 days a week. So it's pretty fun.
6 days a week. That sounds like hard work. Yeah, and with all those surgeries, therapies, what, and I'm listening, and it sounds like to me you have seen some improvements. And what do you think is the most significant changes or change that happened to you?
The most significant was being able to move my leg, my legs, and yeah.
And I think the last time I saw you at the hospital, you started the walking training, right? When did you start the walking training?
Started I think on maybe week 2 I started, and ever since then it's improved significantly.
Yeah, I think we also have a question from Miss Marie about Dylan. I think maybe Dylan can answer. I can partly answer. Is he walking yet at small steps? Is upper core mobile? So I think these are 2 questions. I think Dylan, regarding your upper core, like core strength, can you tell us a little bit more if you saw any changes in your sitting balance?
It's not 100% there, but with the stimulation on and that helps a lot. Just bringing myself back
Mm.
up, bringing myself forward.
Mhm. Okay. And in terms of lower limbs, I think I can answer partly this question. Miss Maria, he is of course not walking to an extent yet, which we are expecting. I think it's still really far. Mm,
Mm.
But what we're trying to do, we're trying to recover his locomotor pattern again, where he with the help of like brain, he can actually initiate the movements by himself, and he has like of course a very weak walking pattern again. So this is the idea in the initial days, where we are trying to restore the movements to some extent, but with extensive training. If he keeps training, keeps walking on treadmill, on the bars, and in the of course with the help of a walker, I believe those pathways will become strengthened and strengthened, and the ultimate recovery is actually far. But so far we have, I think, excellent signs of initial recovery in his walking pattern.
Mhm.
We also have another question. I think, did you see any kind of pain or any complication? I think we had answered this question, but a patient's father is asking.
No,
Mhm.
no, no
Mhm.
pain. Just as I said before, like a headache from the stem cell
Yeah.
treatment after the
Uh-huh.
first dose. But after the second dose, I didn't really feel no side effects.
Mhm.
Mm-hmm.
I think it's important for people or those patients who are considering to know that this is minimally invasive surgery, correct, doctor? And the recovery
Mm-hmm.
period is not very long.
Mm-hmm. And Mr. Antonio is asking, does he
Mhm.
have better functionality of his fingers and hands? So again, I think maybe Dylan, you can also tell us a little bit. But the treatment will mostly, it was focused on the, of course, lower limbs from the stimulation. So did you see any changes from, let's say, from the stem cell treatment so far in your upper body? Mm-hmm.
Not from the stem cell treatment, no.
Okay. So Mr. Antonio, not so far. And also, of course, the reason was Dylan did not receive, of course, any specific treatment for the upper body motor function, no stimulator. It was only a single stimulator at the lumbar level. Mhm. And also the reason is Dylan also had, I think, a significant recovery already in his upper body before the treatment. So there is very small space, I believe, very small room for improvements. Of course, I think we still hope some improvements will come by, but the space may be very small for any improvements, since he already had recovery. He's of course he didn't have like significant loss of functions. Mhm. Any other questions from your side, Via?
Um, Not really. It's I'm also checking the questions on Facebook. But I think so far is okay. Dylan, soon you'll be finishing. I think you are on the last week, ending first week of June.
Yep.
And time went so quick. Can you tell us, do you have any, like before coming, do you have some reservations before starting the treatment or traveling to Bangkok for the treatment?
Could you explain that again, please?
Do you have reservations or fears or worries uh, before you start the treatment?
No, not really.
Okay, it sounds like you are very ready to do the
Yeah,
treatment.
just wanted to,
Um,
yeah.
and it's 35 days and you're nearing the end. What did you like most during your stay, or for example, the therapies?
Um, the physical therapists are very welcoming and very
Mm,
encouraging, and as well as the doctors, everyone's very up to date. So
mm-hmm.
yeah,
Yes.
Yes.
Yeah, I can see that whenever we see you in the third floor in the rehab area, you're looks like you are, working well with the therapies. And please know that, even after you leave Thailand, we are here for you. You can just connect with us. Of course, we'll do
thank
follow-ups
you,
and stuff like that. So
thank
it
you.
is important that, we we connect and we check if everything is on track, even you are back in Australia.
Yeah.
Okay. I think you mentioned a bit more because I'm very curious to know, what would you say about the Verita Neuro team, maybe the therapist or uh, the person working with you, the mappers.
What would I say?
What, yeah, what can you say?
They definitely know what they're doing. They're very supportive, very encouraging. They show me different ways and how to lift my legs up and how to move around, and yeah.
Mm-hmm. All right. So clearly you have come a long way. There are a few guests who is joining us. And what message do you have for people who are watching, and who maybe they are considering doing the treatment or maybe looking for ways to improve their condition?
What would I say to them?
What message do you have for them?
Just stay, like, do it, and like stay motivated, be consistent, and work hard and believe in yourself.
Okay, good. Doctor, is there anything you would like to add?
No, I think just a small message, of course, to any spinal cord injury patient that these kind of treatments are available. And if anyone is interested, they can share the information with us and we can give our opinion if this is something suitable for them and what are the potential prospects of recovery. So of course, it's yeah. So
Yes.
this is my message. Thank you.
All right. Definitely. For those, this video will be saved and will be posted on the Facebook and maybe on YouTube as well. So if you do have questions, you can just simply contact us. We can also send you the webinar recordings. You can just leave your email address in the inbox, and we'll be happy to provide you. But yeah, I think that's it for now. I don't think we have more questions. And Dylan, I believe you will have your training very soon,
Yeah.
this morning. Thank you, Dr. Nasir, for your time and your medical input and guidance. Dylan, we will continue to stay in touch, all right? And please, we'd appreciate you stay keeping us updated and keep going. And yeah, thank you very much for your time and for sharing your positivity and smiles in this life.
Thank you very much. Yeah. Thank you,
All right.
Dylan, for your time. Have a nice day. Bye.
All right.
Thank you, everyone.
Bye bye, everybody.
Bye.
Bye-bye.